So South Africa has surpassed 300,000 COVID-19 vaccine doses delivered, which is at a much slower rate than some of our neighboring countries. Meanwhile, the country is bracing itself for a third wave of infections following the recording of more than 1,600 new infections in a 24-hour cycle, and this is for a second consecutive day. For perspective, perhaps scientific analysis on these numbers, let's bring in Dr. Ridwaan Suliman, Senior Researcher at the Council for Scientific and Industrial Research. Dr. Ridwaan Suliman, thanks very much indeed for your time. We often come to you when we try to make sense of whether or not there are shifts that are significant enough for us to pay attention. So perhaps let me start there. From your reading of the numbers of the past few days, are you starting to see any kind of uptick that's worth any concern?
Good morning, Ayanda. I think the most noticeable indicator over the past week has been the test positivity rate. It's been on a slight increase over the last few days and has unfortunately surpassed the 5% threshold, both the psychological barrier as well as a level that the World Health Organization has indicated that countries need to maintain this measure below to indicate that we have the pandemic under control. So I think this last week, the test positivity rate currently averages 5.2%, and this is a red flag and a warning that, look, transmission is still ongoing, and we do need to take heed of this and try and get that under control.
Yeah, it's probably just worth reminding our viewer the test positivity rate essentially measures how quickly the virus is spreading. What figure should it be on ideally? You mentioned it's now averaging at around 5.2%. Why is that a concern?
So the test positivity rate, just to recap, is a proportion of positive tests or confirmed cases to total tests conducted. It's really useful to, as a measure to try and quantify any increase or decrease in the infection rates in proportion to the number of tests conducted, bearing in mind that, look, testing does decrease over weekends and over the holidays. The indicator that we would like to remain below, or the level we'd like to remain below, is the 5% level. We have been below this level since the beginning of March, as we moved into the recent level 1 restrictions. So for the past 2 months, we were nationally below the 5% level. However, we've just drifted above this level over the past week. And I think this is a red flag. We do also need to note that the rate does differ in the different provinces, and as we have been seeing a resurgence in number of the smaller provinces, so too the test positivity rate in these provinces has been concerningly high. Yeah,
speak to me a bit more about those regions. Which are these provinces, and are we getting signs where this uptick may be coming from?
Sure. So after the Easter long weekend, we saw a sustained increase in 3 of the smaller provinces, noticeably in the Northern Cape, the Free State, and the Northwest. The latest indicators of the test positivity rate in these provinces, in Northern Cape, we're just at 16.6%, in the Free State, almost up to 15%, and in the Northwest, just over 11%. So all of those are above 10%, which is of concern, and some response is needed. And not only is that indicator up, we see that the number of cases and the infection rate in these provinces has been on a steady increase. Fortunately, the Northwest has stabilized over the last week or so, but the other 2 remain in a resurgence.
Yeah, I mean, this might take some people by surprise because all 3 of the provinces you've mentioned previously weren't sites of concern. In fact, traditionally speaking, for lack of a better term, we were worried mostly about the Eastern Cape, Gauteng, and the Western Cape. Have you pinned this to anything from your reading, or is just, I guess, an anomaly that we're just going to have to accept?
Look, it's difficult to fully quantify. I think there's some sort of theories that, look, there's higher immunity levels in areas which were hit harder in the previous wave. But as we know, we don't quite know how long immunity lasts. We don't quite have a full picture of what immunity levels are. We do need more seroprevalence studies. So it's difficult to fully quantify exactly what's the cause of the increase. I think we also don't have sufficient testing to understand exactly where outbreaks occur. Are there specific cluster outbreaks in schools or in events or so, that sort of data and indication is not quite clear, not coming through. I do recall that there was a cluster outbreak in a few of the schools in the Northern Cape a few weeks ago. But it's difficult to fully quantify. So as you've indicated, the four big provinces are still looking stable. The Eastern Cape, Western Cape, Gauteng, and KwaZulu-Natal are generally, all the indicators are stable. It's in the other smaller provinces, and particularly we started seeing this after the Easter long weekend, where we noticed an uptick in Northern Cape, Free State, and those remain in a resurgence.
Yeah. Let's speak about where we're headed insofar as our climate is concerned. I remember at the onset of the outbreak, there wasn't enough data to suggest to us that COVID-19 is specifically sensitive to weather conditions. It's just that weather conditions changed people's behaviors, and that in turn allowed the virus to act in certain ways. Are we any closer to be able to say, as a matter of fact, that being in winter actually has an impact on how COVID-19 works?
I don't think so. I think the previous theories of the seasonal effects of COVID-19 were sort of dismayed as we, in December, in our warmest months, noticed an uptick, and we saw the second wave of infections and the surge over the summer months here in South Africa. So too was the surge in Brazil at a similar time. So I don't think we can put it down solely to seasonal effects. I think also we need to understand that recently variants that become dominant in certain regions are of concern. And if we do happen to get another variant that becomes dominant, this could drive a third wave. So I think in terms of the winter, the concern is that generally because of the colder climate and temperatures, people are gathered indoors more and in closer contact rather than outdoors where the risk is lower. So I think that is the concern as we move into the winter months now. We do need to understand that closed environments, particularly where ventilation is poor, that remains the highest risk for ongoing transmission. And so that is the concern as we move into the winter months to try and mitigate that.
Yeah. Speak to me about the situation that we're seeing unfolding in the United States. I found it incredibly interesting that Joe Biden had, over the past week, announced that adults who had been fully vaccinated can now be in public open spaces without necessarily having to wear a mask. It's great motive, I guess, for everybody else in the world to get as vaccinated as quickly as possible. However, my understanding is that those non-pharmaceutical interventions should pretty much continue even after we get vaccinated, because COVID-19 is essentially here to stay. Are we getting a different, call it, view from the world of science about this?
I haven't quite followed the situation in the US too closely, but I do agree with you. Some of the communication coming out from the US recently is a bit confusing, and it's sort of contradictory to what we've also been hearing and being advised over the last few months. So it's difficult to fully understand what the recent recommendations, what the scientific background behind that are. The general consensus has been that, look, after vaccination, the non-pharmaceutical interventions do need to continue for a couple of reasons. One, we know that vaccines are not 100% effective. So the efficacy varies between the different vaccines. And so although certainly it improves or reduces the risk of infection, transmission, hospitalization, and severe illness and death, there's still the risk that the transmission can occur and can spread to others. And so the idea is still to maintain the non-pharmaceutical interventions. We also don't know, or at least after vaccination, there's still a window period until immunity does actually kick in, so one can still be infectious. And so, yes, the recent communication by the CDC and the US is a bit confusing.
All right, thanks very much for your take. Really appreciate your sharing what you know with us at this moment. The resounding call, of course, is for us to continue doing what we can to protect ourselves against the still present threat of COVID-19.